Welcome, relational leaders and listeners. This is Cultivate, your podcast destination where we celebrate thriving relational leaders and encourage each other along the influence journey. I am Wendy F. Adams, your host and strategic guide. In each episode, I will engage with leaders who are sharing authentic stories that support impactful influence. I believe work shouldn't be a four-letter word, but should inspire, challenge, and fulfill. Through a high challenge and high support model, we will explore the recipe for relational leadership that drives meaningful change. You will gain insights from leaders who face the same challenges you may encounter and discover strategies to navigate them with resilience and purpose. Daniel Farrell is Help USA's Chief Operating Officer, overseeing a large portfolio of homeless prevention, transitional housing, supportive housing, and domestic violence programming in multiple U.S. cities. Help USA employs 1,200 teammates who serve about 10,000 households annually. Danny is a trained psychoanalyst from the New York Institute for Psychoanalytic Self-Psychology and an adjunct professor at New York City's Hunter College School of Social Work. He has also published multiple papers and book chapters on homelessness in our country. Danny's why is simple. The driving force behind his work is less doing, more being. This self-aware core value affords him the ability to stay connected to the clients and community Help USA serves, as well as the internal teammates that he has the privilege to lead. If you're seeking healthy leadership engagement in an open, empowering, and authentic environment, then you're in the right place. After all, as leaders, we're either driving progress or we're driving the problem. So let's grow together. Well, welcome back to a new episode of Cultivate. It's a catalyst for healthy leadership engagement. And today, I have the pleasure of welcoming another thriving relational leader that's making lasting impact. Welcome, Danny Farrell, Chief Operating Officer at Help USA, to the Cultivate experience.
Thank you so much, Wendy, for having me. I really appreciate taking the time and look forward to our conversation.
And that's exactly it, Danny. It's going to continue to be a conversation. And you and I have had some time to be able to just scratch the surface of who's Danny and what's happening in your space and in your role with the organization you serve. But for the audience, our time will move fast. Jump in and just give a little background on your role and what's happening at Help USA as you serve your community.
Sure. So at Help USA, we're a national nonprofit homeless and housing organization. We're really New York City centric and based, but we have sites and programs in 5 different states across the country. We provide transitional housing, homeless shelters, permanent affordable housing, permanent supportive housing, thousands of units in New York City, New Jersey, Philadelphia, Newark, etc. We provide robust homeless prevention services, domestic violence, IPV services. So we really cover the gamut of services for folks who are in jeopardy of becoming homeless, housing unstable, to if they become homeless, and then the rehousing process to ensure that they live a full life within permanent housing once again.
So it's the full gamut. I mean, what I'm hearing, like whatever stage you are in, which that we'll get into, but I hear sustainability, right? And to be able to make sure that, wow. Well, we know that when we talk about, and we've had this conversation about what we do, it always needs to be tied back to why we do it, right? To keep us centered is what's that why? So you mentioned, and I love this in our first part of our conversation, less doing, more being, right? And I think that that's tied to your personal why. So give us a little bit of what's that personal why for Danny that ties into what you just shared about the why of the organization.
Thank you for that. I started in this field as a volunteer in New York City in the late 80s, recognizing at that point the privilege of not being homeless. Wasn't housing unstable. Well, I didn't grow up in any sort of wealthy or upper middle class environment, very working class. I did recognize that I had something that others did not. And it really, it just so fascinated me not in a in a way that was like, I need to do something. I need to help. It wasn't
Mm.
like fascination just of what it is, but I need to be able to be part of this solution. People living on the street, people who are housing unstable. And so I started my career volunteering by sleeping overnight in a synagogue on the Upper West Side of Manhattan, um, just immersing myself in the lives of mostly men at that time who were experiencing homelessness and on this trajectory toward permanent supportive housing, which at the time in the late 80s, early 90s was vanguard, was new. It was a new idea.
Hmm.
And then after graduating college, I lived abroad. I worked in a missionary in India for half a year or so. When I came back to New York City, I realized this was my calling. This is what I need to be doing with the rest of my life, professionally and to some degree personally. It felt mission based, and I've been doing that for over 30 years now. I've had the good fortune and the privilege to be able to do that at many levels as a volunteer, as a case manager, as a street outreach worker, and then more in upper management as a VP, and then in my current role as a chief operating officer of what I think is a really wonderful organization, Help USA.
Wow, talk about walking the talk. You got yourself right in the center of it, which, again, in the role that you currently hold, has to be one of those key places that when you have someone sitting across the desk from you who is considering joining the team at Help USA,
Yeah.
you can speak from a standpoint of, hey, this is at its core who we are. Is this you? Because stakeholders, including our staff, right? They have to be clear on the vision, that
That's right.
why, for them
That's
to
right.
be champion that. So how do you support staff? How does your team support staff in making sure that their why is aligned with the vision of the organization?
Yeah, it's a great question. It's a constant discussion point that we're having. How do we treat our staff in such a way that we want them to treat our clients? I mean, the first
Yes.
thing in lots of ways, because people need to pay their bills, is that they need to be paid appropriately. They need to be paid a proper wage. And we struggle as many nonprofits with ensuring that our government partners support budgets that support robust salaries. And it is a struggle. There are some partners that are better than others, that we're able to pay more than others. But it is an ongoing discussion point and strategizing, arguing with our government funders to increase rates. It's also part of an advocacy, community, both in New York City and even nationally, to ensure that people who work for nonprofit get that respect and that due. We're not government workers in which we're guaranteed a pension, guaranteed medical insurance for life, whether we're during work or post work into retirement. Quite the opposite. Nonprofits saves government lots of money because they don't have that down the road incurred costs. So the struggle again that we have is making sure that staff are paid properly and appropriately. And while I do think we lead on that, there's still much more work to do. A lot of our staff are not paid at the level that they should be, quite frankly. And that is, like I keep saying, that is an area that we do fight on. Other things, staff appreciation,
Mhm.
understanding the day to day that staff go through when they're working in challenging environments like a homeless shelter, or working in an office in which folks are coming in and their housing is threatened. They may come in full of anxiety, full of angst, full of anger, and they may take it out on me as a worker because I'm just the person in front of them. So reminding folks, and through lots of trainings, the clinical trainings and maybe not so clinical trainings, of how to manage our clients when they're coming in and they're just angry, not necessarily at us, but it comes at us. And I get calls like that from our clients all the time. Wendy, there was one point early in my career in which a client said to me, he was living in a homeless shelter. This is probably 20 years ago. He said, if it weren't for me living in the shelter, you wouldn't have a job. You wouldn't be getting paid. I essentially pay your salary by being in this place. And at the time, I didn't really understand it. I felt a little like, well, what are you talking about? But he was absolutely correct. Absolutely. And it really, really, there is a moment, and there are many moments in which I realized we do work for our clients. They are our customers. And without them, we want to close down transitional housing. We don't want there to be a need for homeless shelters in our world. But like emergency rooms, we know that there's a need for folks to be there at some points in time. But I deeply recognize that we have to be client-centered, and in order to be fully client-centered, we have to be staff-centered as well. We can't just look past our staff directly to the client. Staff have to feel like that they're included in decision making, that they're included when it comes to compensation, and even wrote things like HR and what kind of benefits are we offering? Not just medical or dental, but are we offering tuition reimbursement? We do. Are
Mhm.
we offering robust vacation and time off? We do. Like, what are the other things that we can provide for our staff so they feel like that they are supported as they should be?
You have addressed so many elephants, right? What from compensation to does someone feel invested in to, oh my goodness, those that we serve, they're being brave and bold and stepping out and raising their
Yeah,
hand and saying that they have need. How do we view them? And boy, did that client not let you know, hey, without me, there is no reason for your position. And
that's right.
so what I'm really excited about and what I want to celebrate and what you just shared is how many places that you're opening conversation. It's got to be because you've got a seat at the table with your leadership, but
Yes.
then also bringing that conversation to the rest of the staff and the team and letting them know that they also have a seat at that table. You know, nonprofit industry, equally challenging and rewarding, right?
Yeah.
We know that there is more that we have to do with not enough resources for
Yeah.
to get the job done. And as in this sector, we're always out there to tell the story. And that's what I've appreciated about what you've even done here today. We learn best as humans, but certainly in this aspect of the nonprofit sector and the world that we're in, through the challenges. You know, we can celebrate the wins and we should be celebrating them with all stakeholders. Let's talk about those ongoing hurdles, how to keep mission moving forward.
Yeah.
And again, how do we keep that fire ignited as there's always ongoing change with the teams, your internal teams?
Yeah, absolutely. It is the ongoing discussion that we have, and I'm privileged and lucky enough to have a great leadership team at work in my office that are really staff and client centered. They get it, they
Mm,
understand, and they're also good at saying to me sometimes, Danny, we're not doing enough of this, we're not doing enough of that. Staff are a little upset about this. They're happy about that, but we're missing the mark on this. You know, I'm obviously I don't have eyes and ears everywhere myself, and you rely on a leadership team to really cue you in into how folks on the ground are experiencing their day-to-day life. And so much of our work, Wendy, also is when we're engaged in things like capital improvement for, at a shelter
mm,
for our clients, it's also about our staff working in environments that are healthy for them.
come on.
So one of our main missions at Help on our transitional housing side is converting shelters, closing down or literally converting shelters that were, old buildings, a bit dilapidated. They're not healthy environments. They're not great for the folks who are living there. They're not great for the folks who are working there. And either closing them down and moving them to purpose-built shelters, meaning brand new, ground up built, very intentionally designed for both client comfort who's living there and for staff comfort who are working there. So it creates this environment of like good things can really happen here, even though it's a homeless shelter that clients don't want to be there. But it doesn't mean that it has to reflect that feeling that I don't want to be here. So the first of our brand new purpose-built transitional housing shelters is opening up in literally 2 months in Brooklyn and New York City. And it's beautiful. The design of the client units and rooms are stunning. The design of the office space and the wayfare and the wayfinding for clients and for staff is tremendous. The lighting is good. The way that the wood is presenting is good. Like it's all intentional and thought out. And we have two of those opening this year and then one opening next year. We're also opening up new shelters that are gut renovated, privately owned, and that they're also built to our specifications. So we have one shelter opening up where we have a full court basketball court in the sub basement. That's amazing, not just for clients, but for staff. I look forward to shooting some hoops with clients and staff down there. Like it should be an environment that is just pleasant and that is decent and that allows people to have these experiences that folks may not think that they normally would have in a homeless shelter environment, but Why
or
not?
feel that they deserve, right? I'm in this
Exactly.
place and space in my life. So you're creating a home,
Yes,
and one that, even if we say it's transitional, it's still a home for today, and make it
absolutely.
right. And so that's what I'm hearing. To be able to get to those spaces though, Danny, there's got to be, because let's keep it real and always be there, the pushback, right? I hear you
Yes,
talking about great leadership, and that they're bringing things to the table. That would include your board, right?
yes,
So how
yeah.
active are they in that space? But what is it like when you bring something to the table, or another leader brings something to the table, and you get that pushback? What does that dynamic look like in your space?
You know, in the homeless shelter world, there is a tension point of like, don't make it too nice, don't make it too comfortable. You don't want clients, our client base, feeling too comfortable, then they won't leave. In my 30 years of working in this field with folks who experience homelessness, whether it's on the street or in shelter, that is by far a tiny minority of the total population. People want
Mm-hmm.
their own permanent housing, their own space. They want that key. They want that key fob so they can get in and they can lock the door behind them. That's a basic human right.
It
And it's a
is.
basic human element that we all just want. Yes, there's a tiny little subgroup that may kind of drag that out a little bit, but for the most part, people are happy to say goodbye, even in a shelter environment that might be more comfortable than others. So that it still amazes me that that tension point still exists in that part of the service industry.
Mm-hmm.
I've never bought into it and I don't buy into it now. And as we, like I mentioned, as we're redefining and really recreating our transitional housing space, we're also experiencing that. Our housing placement numbers just continue to rise. It's not related to whether the shelter is a good space or a quote unquote bad space. It's about what's available and what's
Okay.
affordable to people who are in that transitional space. Where could they move to permanently? How are they going to pay that rent? How are they going to pay that mortgage? Is it affordable? Is it near public transportation? That's what people really care about. And when permanent housing is available and it's decent and it's accessible and all of that, people will move on. Absolutely, they will.
Well, and you said it. They want to be on their own, and how can I not only get there but stay there, right?
That's right.
So providing them with what they need today so that they can have tomorrow and beyond.
That's right.
I love what I'm hearing there. Those, we're talking about building into the clients that you serve, and also externally, and also those internally, right? Your staff.
Yeah.
How do you continue to, well, your own expectations, right? In your own career growth, how do you balance that with team motivation across the organizational challenges that you have?
Yeah. I that's a space that I struggle with sometimes. I am mission driven and I believe in the mission of the work to a point where if some systems are acting, or they're not aligned with that, it can get frustrating.
Mm-hmm.
And I have to check myself sometimes because, I feel like I'm in the space of like, well, we're ending homelessness, so we just need to do whatever we need to do to make sure that that continues. But the real world doesn't always work just that simply or directly. We know that.
Yeah. Yeah.
I think for me and my team, it's also just a lot of the soft things. We go out to dinner with some regularity. We go out for drinks regularly. We have these like operations meetings at the end of a day, and then afterward we all go for a quick drink. I buy them, and then folks go on their way. And it's a way to, as a unit, as a team unit, to decompress, and not just decompress, but to continually connect with one another. You
Yeah.
know, I'm I'm also concerned with the relationships that my team have with one another, because if they're not
Mm-hmm.
gelling well, then that's going to interrupt our mission, right? That they need to not just, they don't need to love each other or even like each other to some degree, but they need to relationally be able to get along to keep the mission moving and to keep it alive. It's also a way for me, and not just to remind the team, but to remind myself, like, we're here because of something important, something bigger than us, something that's
Yes.
important because it matters to permanent housing matters to, it's not about them and us. It's all of us. And it is a constant reminder, at least for me, of my privilege, of my empowered position as a white male, that there are struggles that I just don't have in the world that others unfortunately just do, ascribed by society in a way that we
Mm-hmm.
know that is just not equitable in that regard.
And
For
you, yeah, that's
yeah,
self-awareness. I just
no,
that is not something to be taken lightly and not something to gloss over. We all have to be in that place of wait, and you said it, like, let me check myself. Where
yeah,
am I in the midst of this situation? And then where can I and should I have a responsibility to make moves for the sphere of influence that I have around me? We are 360-degree individuals. The
yeah,
day, and you are in HR, of check it at the door, that's a thing of the past. There's a
that's
difference
right.
between I've got to be a professional and polished, yes,
Yes.
but I am the human who is coming in the door who fill in the blank of what I was just experiencing. And you know what? Those that we're serving, well, they appreciate that because they're bringing a whole lot to the table. So, again, being self aware, but being authentic in that
Yeah.
self awareness, so very important. We talked about how it is you're in a relational business serving
Yes.
that, so
Yes.
you've got to be relationally strong and
Yes.
healthy within. How does that look for career development? So beyond someone's title, how do you speak into, and not just title, but prospectively, how it looks at Help USA, but then beyond for this person? Not everyone's going to be here for the 25 years or the,
Right.
what does that look like, and how are you and the organization pouring in to the staff that you have to develop them in their career?
Yeah, it's a great question, and it's not a simple answer. I mean, we do
Yeah.
have some really good folks who are dedicated to that. We have a small department, a training department, development department that holds all of these really great, like sub organizations within. We have a Beam organization that's
Hmm.
hosting an event next Friday for Black History Month, right? We have embedded trainings, and not just to train how to do X, Y, and Z better, right? It is about the relational, it is about the connectedness, and it is about bringing our full selves for good and always not so great, the traumas that we've endured in our lives and
Yes.
the
Yeah.
disappointments that we've endured, but also the resiliency that we bring, and also the strengths that we bring, all of it to the table. Because honestly, our clients bring most of that to us, right?
That's
For
right.
much of our work, we're going to where they live, whether transitional or permanent. We have a few offices that don't work in that way, but the majority of our staff, 80% of our staff, they go to work every day or just about every day to where people live. So they're seeing all of it, right? The
Mm-hmm.
messiness and the beauty of it, everything. And that at some level, it needs to be a reminder, that we have to take all that in, that it's not just a transaction, that it is more
That's
than
it.
that. Yeah. So we do the best we can along those lines. I know in some ways we could do better. We could be better. But that is a constant reminder.
And we do have to have those constant reminders. It's not about the transaction, it's about the transformational, right?
Yeah.
And we say it, but how do we keep that out in front of us? And
Right.
and you spoke that out really well, as far as making sure that each time you have an interaction with someone internally, that you remind them of their humanness, and making
Yeah.
sure that authenticity continues to be brought to the table. I think I said it earlier. I want to
Yeah.
emphasize this point. Those that we're called to serve, we're asking them to be brave, and they
Yeah.
are. We have to, that is a way to honor those relationships and that partnership, by us being brave in the same space and being authentic.
That's right.
I think about our sector, and nothing about it is magical. Nothing about the nonprofit sector, right? So there is no magic wand. But
That's
I
right.
want to hear from you, if you did. Now, this is greater than Help USA. For the sector that you are leading out in, if you had one wish, what would that be to see as a change, as something that we would really improve upon in the sector? And why would you pick that thing?
I would double the salaries of all staff that we have, period. Or something along those lines. I would
Yeah.
absolutely pay them the respect that they deserve, and that they don't often get, because salary and compensation in the nonprofit sector is often such a glaring gap, um, for us. And
Hmm.
I think that's true along the continuum of nonprofits, that some are in better position than others.
Yeah.
But in our business, in our specific business, in transitional and permanent supportive housing, it while it has improved, and there are some good government partners that have helped us make some steps forward, it is like paying teachers. It is like paying
Yes.
folks that invest their work lives in really, in people, in relational type work. And that I think as a society, we undervalue those folks. We undervalue us. That would be the number one thing that I would do, like bar none. It wouldn't even be a question for me.
Well, and you didn't hesitate.
No,
You
not at
brought it
all.
up early and you didn't hesitate. But what I'm hearing is that investment piece. It's not just about the dollars and cents. It's allowing those folks to know that what you're doing really is making an impactful difference today, tomorrow, and beyond. But also, I mean, do you want someone who's doing this type of work to have to go out and get the second and the third job to be
Yes,
able to
that's right.
maintain their own livelihood?
That's
So
right.
I appreciate that, and the fact that you are using your position at the leadership table to continue to bring that up. We talked. I just mentioned briefly your board and how that is an important component of your leadership. That's where a lot of that conversation of beyond today, how are we going to sustain? So talk to me about strategic plans and what that looks like at Help USA, where you might be in that process. And yeah, how does your board speak in?
So yeah, so we have a very supportive board. We have a lot of new members. We have some members that's been part of the board for many years. There's a nice mix of energy there of folks that are learning us, learning about us, and folks that are deeply embedded, at Help and understand us for many, many years. But they've always been, I found, and in this role for just 2.5 years, I found the level of support is very high.
Hmm.
Um, our strategy is informal, and I will be at the place where we'll develop a formal strategy, I'd say in the near to medium term, but all agree that this transformation of our transitional housing portfolio is long overdue. And now that we have some ability to make this happen, everyone is thrilled about that. Um, the salary, actions that we need to take and that we continue to advocate for, our board is completely on board with that, of course. We host lots of events through the year that are client driven, that are best practices in the field. We have an event coming up at the end of April, kind of our annual conference, as it were. We have clients, with lived experience, as we call it, who speak on that, who present on panels about their first person lived experience of being
Hmm.
homeless or formerly homeless or housing unstable and what that is like for them as a reminder to the professionals we don't just have all the answers, even for those among us, and I'm not one of them, who have been homeless before, right? We have many folks in our organization who have that lived experience of being homeless in the past. Um, but our board is really respectful and understanding that our mission is staff and client. It's really client driven, of course, but also staff driven to a greater degree as well.
Yeah, to be able to
Yep,
advance the mission, definitely, right? They're not
absolutely. Yeah.
an afterthought, and I appreciate that, and the fact of where you are in that process. Again, that awareness of where you are and where you need to be. It's crazy that our time together is come. We're wrapping up here. Time moves so fast.
Yeah.
Um, and I really appreciate Danny you giving a glimpse into your relational leadership story because I think it's so important for us as leaders to be able to speak out and make it personal, right? The whole point of what we're doing here through our time together and at Cultivate podcast is we want to celebrate. We want to celebrate what is taking place through relational leadership and then
Yes.
also be a place of support. Right? We all have those areas that we want to improve in. Some of us are more aware of where they are than others, but
Sure.
when we can hear someone else's story, and then you gave us a beautiful behind the scenes look into specifically what Help USA is doing in the area that they obviously are taking some lead and some charge in. If someone who's listening wants to be able to engage at a deeper level with Help USA to find out more and how to connect, what does that look like?
Well, first go to our webpage. We have a really beautiful and very recently revamped webpage. We have a development team and a communication team that's just doing wonderful things uh, to draw people in to Help USA, whether at our numerous events that we have throughout the year or in a way to donate. There are lots of ways to become involved. Yeah, I would say starting with our webpage, which is I think has become quite robust. We have
Yeah.
a generic email, of course, that people can connect to us, but it's very easy at this moment in time.
Well, I think that there is no doubt, as you said, a basic human need is shelter. And so we can all wrap our head around that. And we know, like you said, not all of us have that experience, that actual
Yes.
experience.
Yes.
Thank goodness. But
Yes.
when the lights shut off because weather says, or we have those points in time, unfortunately, it makes it very real how basic that is and how we can connect. We each add our own unique ingredients to the recipe of relational leadership. We're all bringing our pizza. And so to be able to take the time for us to share those experiences, again, to celebrate and to support, it's what makes us better together. So I just wanted to say thanks again. Thank you, Danny, for sharing and being a part of the Cultivate experience today. And until next time, thanks to everybody who's chiming in.
Thank you, Wendy. Beautifully said. And thank you so much for having me.
Absolutely. Take care.
You too. Bye-bye.
Before we sign off today, I want to send out huge appreciation to our listeners for tuning in. I hope you felt seen, heard, and inspired to level up your own leadership journey. Don't forget to like and subscribe so you don't miss future episodes. And if you're ready to level up your leadership, asking for a friend, or interested in being a guest on the show, connect with me at cultivateforgood.com. That's cultivateforgood.com. Remember, as leaders, we're either driving progress or we're driving the problem. So let's grow together.